In Uganda, a number of people, especially those in southeastern, have majorly suffered from effects of too much fluoride in water. Bunyangabo district has been cited as one of those districts which have water with high levels of fluoride. Their only source of water from Ntambago stream is said to have high levels of fluoride. The situation in Kenya is not different from that of Uganda, as the managing director, Limulu Water and Sewage Company, Dr. Margaret Maina, explains.
Fluoride is one of the inorganic materials that is found in mostly groundwater, boreholes and wells, which have high levels of fluoride. Fluoride has a negative impact in growing children because it affects the growing teeth. The mothers are encouraged, even when they are expecting, not to use water which has high levels of fluoride. It affects the bones. It eats away the bones in a process called fluorosis. It has a negative impact, especially even in the aging population, because it affects the bone formation and sometimes the people are not able to walk. It also affects the body's metabolism, and that is why it is also of health concern through the WHO. Most water sources, their admissible levels are 0.5 milligrams per liter, but you find that most people are using water which is above that. You can find some groundwater which has high levels of up to 20 milligrams per liter, which is not acceptable according to the WHO standards. It is very difficult also to remove fluoride from other groundwater, and what happens is that if a borehole is done and the limits are above a maximum of 3, those boreholes were capped, they were not used for public use. But the water can also be used for other issues like cleaning, but not for cooking, like cleaning and washing. The water can be used, but for drinking purposes, for human consumption, it has those negative effects.
Dr. Maina says high levels of fluoride have raised health issues and bone defects among the elderly. People living in fluoride-prone areas cannot be recruited in the defense forces and the police because they are expected to have weak bones.
In the fluoride-prone areas, when the kids are smiling, you see the teeth are all brown. If you see people with brown teeth, most likely it is because of fluoride water. Although fluoride is also used in toothpaste for stronger teeth, and they say it prevents cavity. But in excess, it is dangerous to the teeth and the bones. It affects the bones, and if it affects the bone, it can also lead to osteoporosis, which is a disease for the bones, where people are not able to bend, they are deformed. People with brown teeth, there is also that social challenge. You know, when we're smiling, we see people hiding their teeth also. And also on recruitment, like in Kenya, if you have brown teeth, it is very unlikely for you to be admitted in the forces, even in police recruitment. So most people, because when you look at their teeth, their bones are also weak. So it is an element of public health concern, and also public health concern in the country because it affects the social, the employment, because like in our area, in a place called Naivasha, those people during the recruitment of armed forces, police, they rarely get the youth from that area because of the nature of their teeth. So I've been working on this area of fluoride removal. It is very expensive to remove, and also the available innovations for fluoride removal are very rare. And sometimes people will buy the equipment, especially in Nairobi, they install in their houses, but actually they don't really remove the fluoride. And the worst thing is that you cannot see fluoride with your eyes. You just look at the water, you find it very clean, but it can be seen through the house fixtures, the pipings, the sinks. You will see them, you will see the metal just eating the other metal. Like in the toilet, you just see the parts falling off, or they are so stained, or they are so corroded.
A report released by the World Health Organization in 2006 indicates that the widespread effects of fluoride in drinking water remain largely unrecognized and neglected, and yet such of the suffering could be easily prevented. The report states that removing excessive fluoride from drinking water can be difficult and expensive. However, there are alternative low-cost options available at local level, such as use of absorptive filters, bone ash, charcoal, or crushed clay pots. A water consultant based in Senegal, Dr. Bobeka Barry, expresses fear that water quality and quantity may worsen in the near future.
Cities in Africa, like the big cities like Dakar, Abidjan, you have Bamako, you have state capitals have shortage of water from time to time. we tend to dump everything without even treating water. The wastewater that is coming from the house and generally is not treated enough and is dumped into the nature, it will come down to the groundwater and pollute. The year 2050, most of the African countries, large number of African countries, especially those outside the forest area, will be lacking water. And that's a huge number of countries. The whole Sahel, Sudano-Sahelian countries like Cote d'Ivoire, like Guinea, part of Guinea, like part of Ghana.
A water consultant, Dr. Bobeka Barry, on quality and quantity of water. Funizawa Sarah Natoolo reporting.